with me now from Sacramento, California Lieutenant Governor Eleni Kounalakis. Lieutenant Governor, thank you so much for joining us. So what does it mean for voters and poll workers tomorrow?
Well, thank you so much for having me on your show. And I think there are a couple things that are really important for Californians to know. And first is that the Center for Disease Control is still rating the coronavirus risk to public health as low. Our own California Department of Public Health is encouraging people to continue to go about their daily lives, to not cancel public events. Obviously, that includes voting. And then, of course, to take the same kinds of precautions that we should always take during flu season, of washing our hands, practicing our elbow bumps, and not touching our faces to minimize the possibility of expanding through community association.
Let me ask you this. There are folks that might be nervous about going to the hospital. And we just had an epidemiologist on saying that you shouldn't go to the hospital unless you're feeling very sick. But those that are going to the hospital and are worried about medical bills, what do you say to them?
Well, first of all, the symptoms of coronavirus, as far as I understand them from our healthcare professionals, are respiratory. So if you have a stomach ache, it's probably not that. It's if you have trouble breathing, which of course you should immediately call 911 if that's the case. But some of the other symptoms, like Carl talked about, coughs and that kind of thing, I think that that's probably good advice, that we not flood our hospitals. But at the same time, you really do want to make sure that you take precautions. So if people are not feeling well, they should contact their healthcare provider as the first course of action. And if they are uninsured or not sure who to call, they can call the California Department of Public Health, go on our website, and find their local health department, and they can start there. So if it's not an emergency, but someone is concerned, that's really the first place to go.
Lieutenant Governor, are there discussions being had about how to cover the cost so that doesn't fall on uninsured Americans or Americans who can't afford a hospital visit?
Well, I think the main conversation is how do we make sure as a state that we are prepared? And being California, being such a large state with a high population, very connected to the world internationally, we have been preparing for about 10 years for something like this happening. So our Department of Health Services are coordinating regularly with federal health experts and agencies. We are coordinating regularly with local health care professionals and providers to make sure that we have the capacity to address this. So I think that that's very important. And the most important thing we really need to be thinking about is making sure that we minimize the impact to public health. And certainly how we cover the cost of it is also important to people. But if you're not well, you should call your healthcare provider and take it from there.
California Lieutenant Governor Eleni Kounalakis. Kalimera, Eleni. Thank you so much for coming on.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.